各位媒体朋友，大家下午好，欢迎参加国务院联防联控机制举办的新闻发布会。近几日，我国新增本土确诊病例和无症状感染者继续下降，但有的地方本土传播尚未完全阻断，疫情防控形势依然严峻复杂。要始终坚持外防输入、内防反弹的总策略和动态清零的总方针，不犹豫、不动摇。
and the general principle of dynamic case clearing, we must consolidate four-party responsibility and implement four earlies to improve response capacity. We must be alert. For any case or cluster cases, we must stamp out the source to curb onward transmission. We must strictly improve the health monitoring and advocate the general public to wear masks, have good hand hygiene, good ventilation, less crowding. We must improve grassroots fundamental efforts to implement all the efforts. In the key places, we have ongoing prevention control measures, and for people at high risk, they are put on closed-loop management. We will continue to press ahead with vaccination for the elderly, particularly the full-course vaccination and the booster dose vaccination. Today, we will focus on the theme of raising against the time, consolidate and refine control measures. We have with us DDG 雷正龙 from the Disease Control Bureau of National Health Commission, DG Madam Guo Yanhong from the Health Policy and Hospital Management Department of NHC, Chief Immunization Planner from CDC, Mr. Wang Huaqing, Head of Community Control Experts Panel of COVID-19 Response from National Health Commission, General Medicine and Continued Medical Education Institute of Peking Medical College, Mr. Wu Hao, to jointly take your questions. Now we will open the floor for questions. Please raise your hands if you have questions, and please identify yourself before you ask questions.
我们先来请左侧区第一排，第3位男记者。
谢谢主持人。 新华社记者。
Thank you. With the Xinhua News Agency, in last week's press conference, it was introduced that the overall situation has turned for the better. However, the situation remains stark and grim, and there must be the expedition of the response to cluster cases. What is your take on the current situation in our country? I'd like to invite Mr. Lei Zhenglong to take the question. Thank you for your question. Recently, the overall situation in the country has been on continuous decline. For the case numbers since May the 5th, daily new infection has been below 5,000. On 12th of May, yesterday, domestic new infection has decreased to below 2,300. The situation in Shanghai is turning for the better. New infection number has been on steady decline. In Jilin province, the pandemic is tailing off. In Beijing, there has been decreasing number of new infection recently, decreased from more than 70 cases during the peak to only 47 yesterday. This number has shown that our control measures have been effective. However, there are still reports of infection identified in the non-controlled area. Community transmission risk remains. And in Guang'an of Sichuan province, we must expedite epidemiological survey and screening in Henan, Jiangsu, Zhejiang, Jiangxi, Liaoning provinces. The pandemic is also stabilized. We still need to make efforts to clear cases. At present, the pandemic is still pummeling the world, with the virus constantly evolving. The final trajectory of the pandemic still has a lot of uncertainties. China will continue to be faced with the enormous pressure of imported cases or domestic rebounding. National Health Commission will unswervingly uphold the general principle of dynamic case clearing and guide localities to rapidly respond to the current cluster cases, test, quarantine, admit, and treat all those that should be tested, quarantined, admitted and treated to rapidly curb transmission. Localities should expand the scope and channels of monitoring to improve the sensitivity of alarming, improve emergency response team workforce building, and be prepared for quarantine and treatment efforts. Ongoing control measures must be promoted. Vaccination and scientific research should also be promoted. We must make a holistic balance between COVID-19 response and economic social development and consolidate the social fabric of defense.
谢谢主持人。中央广播电视总台财经节目中心记者提问：日前，国务院联防联控机制电视电话会议强调，要在大城市建立步行15分钟核酸采样圈。那么，请问目前我国核酸检测能力如何？那采样点增多之后，核酸检测人员能否满足需求？最重要的是这个检测的准确度以及效率如何保证？谢谢。
After the establishment of the 15-minute NAT testing circle, how can we ensure there are enough staff and the efficiency of accuracy can be guaranteed? Madam Guo Yanhong is taking the question. After 2 years of efforts, NAT testing capacity in China has made major progress. Now there are 13,000 health institutions, 153,000 technicians who are capable of providing NAT testing services. On a daily basis, we have a total testing capacity of 57 million tubes per day. In general, the NAT testing capacity has been substantially boosted. In metropolitans and megacities, we plan to set up the service circle of 15 minutes walk to an NAT testing station, which is to provide convenience to the general public. It also helps to early detect the infected, improve the sensitivity of our early warning, so it will be conducive to control of the pandemic. In Hangzhou, Shenzhen, and other cities, the 15-minute NAT testing circle has been put forward underway. Great achievements have been scored. As the journalist has asked, what will be the needs for the hands of the staff and the efficiency and accuracy of testing? On one hand, we place emphasis on the technicians who conduct NAT testing. With these 2 years of efforts, we have reserved such workforce, and also the sampling staff. Since we have mapped all those NAT testing stations, we must ensure there is a sufficient and well-equipped and qualified NAT testing workforce. Localities are making active exploration, and they encourage the health professionals or those with a health training background, after get proper training from the local health institutions or administrative units. They can all join the workforce for NAT testing. On sites of the NAT testing, there are also staff who are in charge of the information collection, maintenance of order, taking questions from the general public. For supporting staff as such, they can be recruited from the community workers or volunteers. To ensure the efficiency and quality of NAT testing, the inter-lab QC and within the single lab QC and QA have been improved, which is underpinned by a robust information system. At present, the NAT testing time has been substantially reduced, thus increasing efficiency by a large margin. Apart from the regular in-lab QC, we've also organized the National Quality Control center and provincial quality control labs to conduct inter-lab QC. We have already conducted the inter-lab quality assessment over 35,000 labs with 99.7% qualified.
好，谢谢，请继续提问。
Well, thank you. Next question, please.
我们来请左侧区
We would like to give the floor to the lady on the second row to the left zone, please. Well, thank you, Mr. Moderator. I'm from Caijing magazine. My question is that, judging from the data of the senior citizens who have been infected by Omicron, for those who have not been vaccinated or have not been received twice or booster, what are the differences in terms of the protective effect of the vaccine? Will be the risks of the severe disease as well as the risk of the fatality? Well, thank you. I'd like to give the floor to Mr. Wang Huajing. Well, thank you for the question. So if you look at the region in China, which has been severely affected by Omicron, so if you look at the statistics for the citizens who have been vaccinated, who have been received 2 doses, as well as the boosters, there have been marked differences of those senior population. We've seen clear differences for those senior citizens who have received 1 dose, 2nd dose, or booster. So in terms of the differences, we look at to what extent they can be infected. Also, we look at not just the incidence of the disease, as well as the risk of severe symptoms, as well as the death or fatality. Based on the statistics of Hong Kong, for the senior citizens aged between 70 to 79 years old, those who have never received any vaccine, the fatality rate was 5.51%, whereas for those, again, 70 to 79-year-old citizens who have received first dose or 2nd dose as well as boosters, the fatality rate was respectively 0.59% and 0.16%. That means those who have never been vaccinated, their fatality rate is 9 times or 34 times of those who have received 2 doses of vaccines and 3 doses of vaccines. Another study was based on the data in Jilin City of Jilin Province. The result has been released as well. It looks like those who have received 1 dose of vaccine and those who have received 2 or 3 doses, their fatality rate is less than 1/20 of those who have never been vaccinated. So quite clearly, for those population who have been vaccinated, especially who have been boosted, they have a much higher level of protection against the virus, especially against the fatality rate. So next question. So the the male journalist on the 3rd row. I'm from South Metropolis Daily. So we know that the infection rate of Omicron is very fast and it's also very secret stealthy. It has caused a lot of challenges to the community prevention and control. So I've seen that we've seen some community spread in some pandemics. My question is that do you think the previous measures or standards of community prevention is still applicable? And against the current situation, how the grassroots community will try to exercise the early vaccination, early prevention, so as to stop the spread of the virus. Mr. Wu Hao would like to answer the question. Yes, the Omicron pandemic is quite different from previous waves of the pandemic. Like you said, it's quite much faster and it's quite very stealthy, very secret. So therefore, we have put in place some new measures. We have identified the zones into the lockdown and the control zone as well as prevention zone. Also, we have put in place different measures with regard to 3 different zones. I believe this differentiation has proved to be a quite effective response. So in response to the new features of the Omicron pandemic, well, firstly, we have accelerated the time of the lockdown or lock-in. So also we have adopted some temporary measures. Also, the quarantine days have been shortened from 14 days to 10 days in Beijing, for example. But secondly, we tend to adopt some temporary measures. We try to put into place very fast screening and checking as well as the COVID test, so that we try to avoid the overflow of the community spread risk by adopting very fast COVID test. Also, depending on the different situation of different regions, all the measures are evolving. For example, we have leveraged our IT advantage, trying to popularize the different code. For example, the venue code, we have to show your health code. Also, we have this electronic fencing, which has increased the accuracy and efficiency of community prevention control. So how we can achieve those early prevention? We must leverage advantage of our unique system. The Communist Party must play a leading role. Also, we have to make sure that all different levels make sure they shall be responsible, as well above their work mechanism. Make sure all the full parties shall fulfill their obligation and responsibility, so that we have this massive prevention scenarios. And make sure that the residential committee, public health committee, will play their due role to make sure that and understand the situation of key populations, so they know what's going on out there. Also, the relevant entities, relevant regions must do a better job in terms of education, publicity, so as to enhance the awareness of the public health as well as the epidemic prevention. And so we must properly look at a lot of COVID test venues. Just now, my colleague also mentioned that we must make sure in the big cities anyone can find a place where they can do the test within 15 minutes of work. Also, we must make sure that we have a multiple risk alert point. Once something is identified, we shall try to resolve the situation as soon as possible, so that we can identify the cases as soon as possible and put into the relevant measures to prevention as well as treat and quarantine. Next question. I think next journalist to the left zone. Again, I'm from CGTN. My question also about the COVID test. Many population are quite concerned that such a massive test might cause further community spread, as well as for the infection. So what will be the precautions they need to take when we organize such massive testing? Okay, give the floor to Madam Guo Yanhong. I'll take the question. For large-scale massive COVID test, to do it well, not only we need to have the relevant capability to do that, also we must make sure that we do a better job in organizing such massive COVID tests. In order to, for all different regions do it relatively well, we have already released 3 versions of COVID test organization guidelines guiding different provinces and municipalities to do a better job. So I think when we are doing such massive COVID test organization, I think 4 points stand out which we really need to handle really well. Well, firstly, we must make plan, must take all the precautions as well as better job in organization. We require all different regions to come up with a clear plan, kind of summarize all the precautions, to make sure that you have the relevant entity which is responsible. You want to understand all links of their process. You also have a clear understanding of the specific realities on the ground, for example, the population, where they are, and you must set up your sampling location depending on the situations of your community. For example, different buildings, different community, different streets. Also, you must make sure that the testing agencies must be fully capable to handle such massive tests. Also, we need to leverage IT system to submit the testing results to the public as soon as possible. In the meantime, you can conduct further analysis based on those tests. So those plan, those emergency response plan is very important. Whenever such massive public test is necessary, that plan, the action plan, can be actually put into place immediately, so all the different agencies will start working, including doing the testing, sampling, submission of the result, and doing the analysis. Well, secondly, when it comes to the setting up all the sampling location, it's also very important. Our requirement is that you must optimize the deployment of those testing locations. You must do so based on the number of population, your geographic situation, as well as the actual situation of the testing agencies. The reference number is that you need to have one sampling location every 2,000 to 3,000 people. You must have probably one sampling station every 600 to 800 people. So make sure that all the testing tasks can be completed within 6 to 8 hours. In addition, we also require that in principle, in order for the people to be conveniently tested, within each residential compound, you must have a sampling location. In this season, probably have a kind of outdoor testing place.
就是室外的采样点，也可以选择像我们的体育场馆，
So we prioritize the choice of stadiums, exhibition centers, playgrounds, and other well-ventilated outdoor places. And third, we must improve the on-site organization and management of the NAT testing stations. There must be clear direction to the exit and entry, have a proper planning of the routes to ensure one-way flow of the subjects, to avoid and refrain from crowding. We ask the citizens to have a pre-appointment, and we provide notices to avoid crowding and to shorten the queuing time. At the places of the NAT testing, we also have working staff and volunteers who are to help with the order maintenance and guide the general public to have a good personal protection and to collect their information. For some special groups, including the elderly, the maternal women, and the disabled, we have provided them with green tracks or faster tracks to ensure the humanistic caring. During the NAT testing in different localities, there are some innovative ways. For example, for the most senior citizens, we provide outdoor NAT testing conducted by the community workers so that the senior don't have to leave their homes. We also ask the general public to give us greater support. For the general public who participate in the mass NAT testing, they must wear masks, refrain from gathering, keep good social distance, voluntarily follow the organization of the on-site working staff. During the NAT testing, they shouldn't touch the objects on the testing console, and after the testing is completed, they are advised to wear their masks and immediately leave the NAT testing place. It's not easy to have a safe and smooth NAT testing on a massive basis. We need good organization. We also thank the general public for their support.
好，来请右侧区第3排最靠里边这位外媒的记者。
Hi, Bloomberg News. I have two questions. The first is, given the Shanghai is close to zero spread in the community and Beijing has so far avoided a lockdown, what are the experiences gained so far, and how will you adjust the dynamic zero approach to make sure that other cities don't have to lock down or undergo disruptive restrictions? And my second question is, considering what you're talking about with all the cities that will have very regular mass testing, places very close to where people live, is it safe to assume that mandatory regular testing will be rolled out for the whole of China? Thank you.
请翻译一下问题。
我有2个问题，来自于彭博。第一个问题是呢，上海今天早些时候宣布5月中实现社会面清零。北京呢，昨天也提出要继续采取动态清零的行动。请问京沪两地的防控为动态清零调整提供了什么样的经验，能够在未来避免国内特大型城市在不进行封城或静态管理可能带来的不良影响下，遏制住新冠病毒的大面积传播？第二个问题是，我听到有常规常态的在居民居住区附近的大规模的核酸检测，那这样的核酸检测是否会在全国推行？谢谢。
好，我们请雷正龙先生来回答这个问题。
I'd like to invite Mr. Lei Zhenglong to take the question. Thank you for your question. Since the outbreak of the COVID-19, the Chinese government has consistently prioritized people and their life. We've upheld the general principle of preventing imported cases of domestic rebounding and the general principle of dynamic case clearing stamp out the sources of any cluster cases. In Shanghai and Beijing, we are racing against the time in COVID-19 response to curb and stop community transmission. As the virus is constantly evolving, we are constantly learning and taking stock of experiences to improve control measures. We guide localities to act early and scrupulously and be faster than the virus. Test, quarantine, and treat all those that should be tested, quarantined, and treated so as to curb the transmission with the minimum price within the smallest scope and within the shortest possible time. Meanwhile, we are stepping up our control preparation, improve regional coordination. An array of measures have been adopted in reserving the Canbin Hospital, designated hospital, quarantine venues. The regular NAT testing is to improve the early detection capacity. We have been constantly improving the treatment system to ensure that the regular and routine needs of the general public to seek medical advice can be ensured, and we have been pressing ahead with the vaccination. 2 years of practice have shown that the dynamic case clearing has been proven effective to protect the life and health of the general public. It is the proven optimal choice for China to have holistic balance between COVID-19 prevention and economic social development. Thank you. Next question, please.
谢谢发言人。中国网记者提问，想请问奥密克戎变异株对老年人的危害是否依然很大？谢谢。
My question is,
我们请
does
王华庆先生
Omicron
来回答这个
still
问题。
pose great
谢谢这位
risk
记者的提
and
问。
danger to the
其
elderly?
实新冠疫情
I'd like
流
to
行了
invite
很多了，
Mr.
病毒
Wang
一直在
Huaxing
发生
to
变异。
take the
那么
question.
导致重症或导致死亡的，尤其
In
对
the
老
past
年人
2
来
years,
说呀，
the
还有除了
elderly
这个
is
病毒的因素
the
以外，
group
其实
that
还
has
跟它
been
这个疫苗接
experienced
种
the greatest
是否
hazard from
是否
the
年龄大
pandemic.
和是否有基础疾病的因素有
The
很大的这个关
fatality
系。
and the severe case rate among the elderly have something to do with whether they suffer from underlying
没有接种
disease.
疫苗的老年人，
In
那么
the
他的重症和
affected
死亡的比例
regions,
呢，还是
the
比较
elderly
高的。
without
另
vaccination
外一个呢，
suffered
我
from
们
a
看到这个
relatively
奥密
high
克戎
rate
变异
of
株，其实对于
mobility
未接
and
种疫苗这些老
severe
年人来
cases.
说，它
In
的危
face
害
of
呢，仍然是
Omicron,
很大的。
it still poses a great threat to
那么香港
the
卫生署
elderly.
公布的这个
According
信
to
息
the
显示，
information released by the Health Department of Hong Kong
他们
SAR,
80岁以上
during the
未接种疫
prevalence
苗
of
的老人，
Omicron among
他的
the
病死率
elderly
达到了
above 80 years
16.5%。
old, those
这样的水平。
unvaccinated
其实这
suffered
个病
a
死率单
fatality
从
of
数据上来看，和我们武
16.5%.
汉早期报道出来的80岁以上的
Simply
人
judging at
病
the
死这个
number,
结果
the
14.8%是非常相近的。
16.5% was
所以呢，我们
close
看到
to
这
the
个奥密克戎变异株，其
14.8%
实
of
在
fatality
老年人，尤其是高龄
initially
人感染之后
identified
不接种疫苗
among
的话，
the
那么
deaths
它带来
in
的危害
Wuhan
呢还是
during
比
the
较大的。
early
谢
time
谢。
when the pandemic hit.
好，谢谢，请继续提
Therefore,
问。
for those
好，先来请
unvaccinated
右
elderly,
侧区第二
Omicron
排
still
考核
pose
到的第一
great
位记者。
damage.
谢谢主持人。每日经济新闻宏观频道记者提
With
问：
the
近日来，
Economic
一些发
Daily,
生聚集性疫情的地区
recently
开
in
展创建
some
无疫小区的工作。
cluster
我们记
case
得2020年的时候，武汉评定了无疫情
affected
小区、
regions,
社区
they are
村大
pressing
队。
ahead
请
with a
问无疫小区
pandemic-free
是什么样的考
community.
评标准？
I
谢谢。
remember there were such
好，我们请
efforts
吴
during
浩先生来回答这个问
2020
题。
Wuhan response. So, what is the criteria of free community free of a pandemic? Mr. Wu Hao is taking the question. Since the outbreak of the pandemic, we have been adopting specific and region tailor-made approach for the assessment of the pandemic-free neighborhood. We want to set up the pandemic-free community and there is no case. It has a good sanitation, provides humanistic care to the neighborhood residents. The entire neighborhood is mobilized to keep the pandemic free from the community. And all those living in this community have completed one round of NAT testing, all negative. Sanitation standard means there is a standardized sanitation and disinfection. We emphasize the disinfection and the sanitation in key places, and the collection of the sewage and daily garbage and the medical hazardous waste can be categorized. And by health, we mean
So we shall guide the citizens to actively vaccinate, as well to be tested as frequently as possible, as well as the antigen test. Also, they're encouraged to wash their hands as much as possible and wear a mask, as well as other health habits. Also, we need to better in terms of educating, offering health education to the residents, guide their awareness and philosophy of health, so as to respond to the COVID pandemic. By caring, that means that for the special population within the community, we must know their numbers, we must have a ledger or have a records for the situation of those population. We need to understand those low-income residents or residents with special difficulties, as well as, for example, senior citizens without the company of young people. Disabilities practically mean babies and young children, as well as the chronic disease sufferers. We know their needs and situations, so as to identify potential solutions and items of caring and support. We must understand the mental status of those quarantine residents. For those who suffer from anxiety or depression, the community must organize the relevant intervention and guidance professionally. Also, we need to set up this 24-hour hotline to respond to their needs. By mobilization, we're talking about fully mobilizing the volunteers, the party members, as well as the property management company employees, as well as other government agencies who are resident in the company, to under the leadership of the party, offering such support to the residents. We must make sure we have such a mechanism whereby all those forces can be mobilized to provide such support. So that means we can have this long-term mechanism so as to have this health community in the long run. Thank you so much. Next question, please. I think the second lady journalist on the third row to the left, and from Face TV. So currently, those quarantine, how about the development of those temporary quarantine building? Is it possible for those quarantine places to be launched whenever it's necessary? Thank you so much, Guo Yanhong, please. Well, thank you. We know Omicron variant is the predominant variant mutation. As we know, the features of this variant is that has a very fast spread speed. Also, it can be spread in a very stealthy way. Even though the symptoms are relatively lighter, nevertheless, due to the fast speed of transmission, whenever a pandemic has an outbreak, we've seen the surge of infected number within a short period of time. You want to make sure that all those patients will be quarantined and properly treated, so that we can make sure that within the shortest space of time, all those infected people will be hospitalized. In the meantime, they will not have a running of the normal medical resources. In our 9th version of the clinical and treatment protocols, we have clarified that we must have differentiated principles and requirements of quarantine and treatment, which means that for those patients with very light symptoms or actually without symptoms, they'll be quarantined in those quarantine houses
定点医院。
temporary quarantine
那么为
houses
了指
where
导好
those
这
with
个
relatively
分类
severe
收治的工
symptoms
作，我们
will
前
be
期啊，
treated
这个
in the
已经对
designated
方舱医院的
epidemic
建
hospitals.
设
To
以
do
及
that,
管理下
we
达了
already
一些
have
文件，
released a whole set
专
of
门呢
documents
这
for
个
the
要求
building
呢各地
and
要
the
按照我
management
们下发
administration
的
of
新
those
冠肺炎
temporary
方舱医院
quarantine
设置管
houses
理规范，
required
做
all
好呢
provinces
方舱
to
医院的建设准备，
to
确保
make
在
plans
需
for
要
the
的时
building
候
of such
能够
temporary
很快的
quarantine
建
hospital
成
quarantine
并投
houses
入使用。
to make sure that
目
when
前呢，绝大
there
部
is
分
an
省
outbreak,
市都已
those
经按照要
quarantine
求
places can be
设置了一
built
定
as soon
数
as
量的方
possible
舱医
and they
院，
can be ready
也
for
为了
use
应对
at the earliest
奥
possible
密克
time. So
戎的
at
感染
this
和疫
point, I
情
believe most of
做
our
好了
provinces have
一定
already
的
made some
常备
plan,
的
have
准
already
备。
built
而
large
近
scale
期大家可以
temporary
看到各
quarantine
地呢
houses
应
the
对疫情的
Fangcang,
过程
and
当
also
中，
we have the
方
relevant
舱医
equipment
院
and facilities
的
available
启
for
用
those
包
quarantine
括
hospitals.
在
We
吉
have
林
seen
包括在
the
上
launch
海
of
都
such
起到了
facilities
非常
in
这
the
个重要
recent
的这样一个
waves
作
of
用
the。pandemic, especially in GD
那么
and
下
Shanghai.
一步啊，这个我们
The
也要
role
求
of
各
such
省
temporary
做
quarantine
好
hospital
疫
have
情应
played
对
a
的
very
准备
important role.
特别是在
So
方
going
舱医
forward,
院的
we
这个建设
require
上
all the，
要
provinces
呢
to
做到
prepare
有备无患。
when
那么我
it
们
comes
主
to the
要是
building
做
of
了
such
呢
quarantine
这个
houses.
3方面的工作要
We
求。
have
第一
laid
呢，
out
就是
three
进一步要求
requirements. Well,
各个
firstly, we
省
further require all
以
provinces,
地级
municipalities,
市为单位，
based
按照
on
平
the
战结合的
regional
原
city
则，
level,
常规建
must
设
have the
或者
principle
改
of
造一定数量的方舱医院，
peacetime and wartime
做好
principle.
呢相
We
关的，比
must
如说
try
水
to build or
电、
renovate
厕
a
所
certain number of
淋浴、
quarantine houses.
通
All the
风这
facilities
些基
such
础
as
设
the
施要提
utilities,
前呢做到
toilet,
布局
showers
改
or
造
ventilation
这些布局改造要到位。
must be
那么第二呢，
built
就是要
and be
做
ready
好
for use
方舱医院
beforehand.
医务
Previously,
人
but
员
secondly, we must
和
make sure that
医
all
疗
the
设备的
healthcare
工作。
providers and
我
medical
们要求
staff
按照一定的
must be
配比
equipped to
组
such
建
temporary
好
quarantine houses.
医疗队
We
伍，
have certain
同时呢
requirement
做
of the
好
ratio of
救治
building the
和
healthcare team.
感染控制
And
等
also
方
we
面
need
的
to
培
provide the
训。
necessary
另
training
外要
in
储
terms
备
of the treatment
储
as
备
well as
好
the
呢这个
prevention control
我们
for
的常备
those
单元
healthcare staff.
还有医
We
用物
must
资
have the
医疗设备，
reserve
同
the
时
relevant
铺
number of
好
the
这个
medical beds,
医疗的
other
信息系统。
medical
那
goods,
么
for medical
一旦呢
equipments,
发
as
生
well
疫
as
情
the
能够
healthcare
很
information
快
system
的
whenever
在24小
and
时内
there's
这
outbreak.
个将这
We
些
can,
设
as soon as
备
possible
设
within
施
24 hours, all
能
those
够
facility
进入
equipments
到
will be
我
made
们
available
备好
to
的这
the
个方舱医院当中，
already
同时呢
established
我们
built
的
temporary quarantine
医务
houses.
人员
In the
能
meantime,
够以及相关的
the
设备能
medical
够
personnel
投入
and
到位。
relevant equipments
第
will
三呢
also
就是
be
保
put
障
into
好
place as
方
soon as
舱医
possible.
院
Thirdly, we
的
must
管理
guarantee
和运
that
行，
there is proper
统筹各部
administration
门
and running
全
of
力
such
保障好方舱医
quarantine
院的
hospitals.
建
We
设
must call in
以
the
及
relevant
建设后
resources,
的
all
正
different
常运
agencies
行，
when it
确
comes
保
to
呢
the
在有需
construction
要
as well the
时
proper functioning
能够
of
在
such
一天内，
temporary
也就是
hospitals.
24
So
小时以
so
内
that when there is a
转
need
化为方舱
within,
医
let's say,
院
24
投入
hours,
使用。
those
这个
facilities
能
will
够
be
呢
converted
很
into
快
properly
的
functioning
收治病
temporary
人，所以
quarantine
呢，
hospitals
实现
as soon as
啊
possible, so
应
that
收尽
the
收，
patients
应治
will
尽
be
治啊，这个
quarantined
支撑
into those
谢谢大家。
facilities as soon as possible and
好，
receive
谢谢。
necessary treatment. Thank you so
请
much
继
for
续
your
提问。
question. Next question,
来，
please.
请右侧区第一排，考古道第一位
To
记
the
者。
right zone, first row. That
谢谢主持人，香港
reporter.
中评社记者提
I'm from
问：
Hong Kong.
目前大部分
Common
奥密克戎
Service.
感染者症
Well,
状相对于
currently,
其他
most
感染者
Omicron
较轻，
patients have
这让一些
relatively
本身存在
simpler,
疫苗
lighter
犹豫的人
symptoms.
更加觉得没有必要
Therefore,
接种
those
疫
who
苗。
have not
请问
been
这种观点是
vaccinated,
否
who
合
are
理？
hesitant to
另外，
be
有些人群患
vaccinated,
有肿
we
瘤、
found
免
it
疫缺
even
陷和自身免
unnecessary
疫
to be
疾病、
vaccinated to
基础
defend
疾
this
病
point
等。
reversible.
这些人
Also,
群也是
some
感染后
population
会
with
得重症的
underlying
这种高危人
disease
群。
such as
请问这部
tumor
分脆弱人群有必要接种疫苗和
immunodeficiency,
加强
as well as some other own immunity system disease and underlying diseases. So typically this population will end up having relatively severe diseases. Do you think this population will be even more necessary to be vaccinated and receive booster? Well, thank you for the question. Ms. Wang Hajin, please answer the question. Well, currently, as we know, this Omicron variant has these features of faster transmission and stealthy transmission. Therefore, the infection risk is being amplified. For those unvaccinated, especially those senior or elder citizens who have not been vaccinated, they still find themselves in the grave risk of finding their way into ICU or even being killed. So the current research study monitor shows that the COVID vaccine have played a very important role in reducing the severe disease, severe symptom, as well as the fatality. And despite the constant limitation of the virus, I think there has been global consensus with regard to the population-wise universal vaccination, including the universal booster vaccination. Response to question to those vulnerable population who have a lot of underlying device and who often end up dying and being dead or suffering major disease symptoms. I think that's been very clearly proven. Let's again take Hong Kong example. If you look at those people who were dead, who were killed by the virus, 90% of them had chronic disease or other underlying disease. So the reasons are twofold. Firstly, if you have underlying disease, if you're infected, on the one hand, the virus will cause complications or other symptoms. Or secondly, a lot of research show that this COVID virus will, in fact, worsen your underlying disease, and will cause a lot of comorbidity and cause a lot of complications. Therefore, I believe those population with underlying device will be, they really need to be vaccinated and receive a booster to be better protected. Thanks so much for the question.
好，来请左侧区第3排第3位记者。
中新社记者提问，谢谢。请问全国疫苗现在全国疫苗接种的情况如何？其
What
中
is
关
the
于老年人
progress
疫苗
of
接种的工作
vaccination
进展
across the
是如
country,
何？谢谢。
in particular the vaccination
雷
among
正
the
龙先生
elderly?
来回
I'd
答
like
这
to
个问题。
invite Mr. Lei Zhenglong to take
谢
the
谢您的提问。
question. Thank you for your
根据
question.
国务院联防联控机
According
制
to
部
the
署，
deployment
目前
of
我
the
们
State
继
Council
续指导各
Interagency
地积
Task
极稳
Force,
妥
we
推
continue
进
to
新冠
guide
疫苗的接种工
localities
作。
to actively and
截至
steadily
5月
promote
12
vaccination.
日，
As of
全
12
国累
May,
计报告接种
across the
新冠疫
country,
苗
we have
33亿
accumulatively
5857.6
vaccinated
万剂次， 接种总人数达
3,358,576,000 doses,
12,819.5
covering
万，已完成全疆接种
1,287,195,000 people.
12,759.2 万人，覆盖人数和全疆接种人数
1,252,592,000 people have
分别
completed
占
the
全
full
国
course
总人口的
vaccination,
91.3%、
covering 91.3% and 88.85% of the
完成
total
加强免疫接种
population,
7亿
respectively.
6,289.7
762,897,000 have got booster
4,4.9 万人。
vaccination, with
60岁以上老年人接种覆
33
盖人
million
数
plus
达
got
2亿
sequenced vaccination
2,823.6
booster
万人，
doses. For
完
the
成全
elderly
疆接
above
种
68
2亿
years old,
1,625.3 万人，
228,236,000 have been vaccinated, 260,253,000 have got the full course vaccination, 86.44% and 81.9% of the total elderly population,
32.3 万人。
respectively.
各地按照国家的各项工作要求，
Localities have
进一步
been
加强
following the national
预防
working
接种的
requirements
实施，
and continue to
加大宣传力
organize
度，
and improve
同
the
时因地
vaccination.
制宜，开拓思
Publicity
路，
was stepped up.
充分考虑
Meanwhile,
老年人接种
localities
需求，
have been looking
延
at
续
their
前
own
次接
local
种工作中的各项
particularities,
便利
giving
措
full
施， 推
consideration to
进
the
精
needs
准
of
预约，
the
设立
elderly.
老年人接
They've
种绿色通道，
promoted precise
开展流动接
appointment
种
and
服务。
set up the fast tracks
近期
for
我
the
们还了
elderly.
解到，
There are also
有
mobile
些省份在
vaccination
实际工作
services
中积累了
provided
一些
outdoor.
值得借鉴
We've
推
also
广的
learned
经
some
验，
provinces have
利用基层医疗卫生机
accumulated
构
some great
为老年人
experiences that
提
can be
供高
rolled
血压、
out.
糖尿病
The
健康管理
grassroots
服务的
health
实施，
institutions,
开展
while
疫苗接种宣传，
providing hypertension
鼓
or
励
diabetes
符合条件的老
management,
年人在接受
also
健康管理
provide
服务的同时
publicity
完
to
成疫苗接种。
vaccination and encourage the
疫
eligible
苗接种
elderly
对预防
to
重
get
症和死亡有
vaccinated
明
while
显效果。
they are
希望大家
undergoing
动员我
health
们身边的
management.
老年朋友们
Vaccination has
积极尽
proven
快接种疫苗。
effects over the
谢谢。
prevention against severe
好，谢谢，
cases and
请
death.
继续提
Please
问。
mobilize those around
好，
you,
先
the
来请
elderly,
左
get
侧区第
vaccinated
2
at
排
an early date.
第2位
Thank you.
穿白色衣服的记者。
谢
谢谢主持人。封面新闻记者提问：社区防控是疫情防控的基础环节。近日，我国多地出现疫情，请问针对居家隔离的人员以及外出就医后返回的患者，社区应该如何管理？奥密克戎传染性强，在这个过程中如何做好对工作人员的防护？另外，等疫情中依然出现了一些隐瞒行程不报备的情况，请问社区应该如何做到早发现？
of Omicron, how can the working staff get protected? In this round of pandemic control, there are still those who conceal their mobility or do not report their mobility. How can community have the early detection? For the close contacts that are put on quarantine, we have the medical observation, and home-based quarantine for the minority of the close contacts who have satisfactory conditions for home-based quarantine and are not appropriate to be transferred to mass quarantine places. For those who are put on home-based quarantine, they need our care. As a Chinese saying goes, the help from your remote relative or family members cannot be mentioned in the same breath with the care from your neighbors. Those in all community can be seen as family during this special time. Their basic necessity needs and the regular medical needs must be ensured. We should guide those who are put on home-based guarantee to have good home-based ventilation, personal protection, separate dish dining, sanitation, disinfection, and proper treatment of garbage. They should follow the rules to get the NAT testing and follow the home-based quarantine guideline issued by the CDC. We'd also like to remind those who need to go back to your neighborhood, please report to your community. For example, if you are in Beijing, there is one small app which is called heartfelt support, and the community will assess your condition to judge whether you can be put on home-based quarantine. And there will be technical facilities installed to ensure that the home-based quarantine people can abide by the rules. Community workers have to have the face-to-face communication with those quarantined people, so they should pay special attention to their own safety and health. Localities need to follow the guidelines for different posts. Scientific safeguard is necessary, but we don't have to overprotect. Third question is about the concealing of mobility, and that violates certain regulation. Even a small loophole in the pandemic control may lead to disastrous results. The success of the pandemic response cannot be separated from the support of the general public. We need to cherish the hard-won achievements, and we advocate the general public to support epidemiological survey. Your support is the respect for the great efforts of the tens of thousands who are working at the front lines. They are also ordinary people who have their family back at home, and they are standing in harm's way to protect your health. So do not conceal your mobility and be truthful in sharing the information can help to be responsible for the general public, minimize the possibility of transmitting the virus to your family members, and reduce the risk of severe cases. We appeal to the general public that you need to refrain from traveling to high and medium risk regions unless necessary. Have good personal protection health monitoring. Pay special attention to the sharing and reporting of the CDCs. If you find any anomalies, please identify and report in the earliest opportunity. Everyone is the person who shoulders the primary responsibility for their own health.
谢
谢谢主持人。中央广播电视总台 CGTN 记者提问
Thank you. With
5月5日，
CGTN,
中央政治局会议
May
上
the
指出，
5th,
放松防控势必会造成大量人群感
Political
染，出现
Bureau
重症和
Conference
死
of the
亡。
CPC,
请问医疗
it
资
is
源部局
mentioned
上重症
that
病例的医疗救治，我们如何安
letting
排？
down
同
the
时，
guard
我们为什
will
么要毫不
definitely
动摇
lead
地坚
to
持动态清零
larger
政策？谢
mass
谢。
of infection and
好，我们
greater
请郭
portion
艳
of
红
the
女士来
severe
回答这个
cases
问题。
and death.
好，谢谢这位记者的提
So
问
how,
啊，大家都
why
知道
should
奥
we
密克戎变异
unswervingly
株
uphold dynamic
传染
case
性
clearing
强，
and
传
how
播
should
速度
we
快，
allocate
它的2.0
resources
值
to the
啊是
severe
9.5
cases? Madam
是
Guo Hong is
Delta 变
taking
异
the
株的
question.
2
We
倍，
know
而
of the
待机
strong
间隔
transmissibility of
只有
Omicron with its rapid
2.83 天。
transmission with R0 values
这个
stands
在传
at
播的过程当中呢，
9.5, twice that
还
of
有
Delta
一定
variant.
比例的感染者是没有症
Intergenerational
状的，
space is
因
only
此它这个隐匿的
2.83%,
传
and
播
there
不
is
仅
a
速度
large
快，而
percentage
且
of
呢
the
不易被
infected
发
do
觉，
not show symptoms,
也增添了许
making
多
it
呀这
difficult
个
to
防
be
控的难度。
detected and adding
但
the
呢，如果
difficulties of
我们要
COVID-19
放
prevention
松
control.
防
However,
控的措
if we
施，
let down
就
our
会在
guard
短时间内
within short
造
span
成
of
大
time,
量人
we
群的
may
感染。
find
而
a
我们国
much
家这
larger
个人口众多，
massive
人
population
口的
get
基数大，
infected given
老龄人
the
口
big
多，
population
而老
base of
年
our
人
country,
以及
and
呢
we
有
are
基础
an
性疾
aged
病的这
society.
些脆弱人
The
群，
elderly and
一旦感染
especially
以
the
后啊，
vulnerable
容
with
易
underlying
发展为
diseases,
重症。
once infected,
再加
are
上我们
prone
国
to
家的
develop
医
into
疗
severe
资源
cases.
应该说总
Admittedly,
量
our
不足，特别
health
是优质医疗资
resources
源，
are not
而且在
of
分布上，
sufficient,
城乡间、
and
区域间
in
也
particular, the
存
good
在
quality
分布
health
之间的不平
resources
衡。
given
那么
the
以呀重
imbalance and
症的医疗资源为
uneven
例，同
distribution
样
of the
啊
health
也是呢，
resources
这个
between
无论
urban
是我
and
们
rural
高
areas
水
and
平
different
的重症
regions,
医疗团队，
and plus
还是呢我
the
们的
lack of
重症的
quality
床位
health
也往往集中
resources,
在
in
大
particular the
医
health
院
resources for
和
the
大
treating
城
of
市。
severe
所以我
cases.
们
We
必
know
须
most
这个
of
秉
the
承
high-level health
人民至
teams
上、
and the
生命
hospital
至上
beds
的
for the
理念
treatment of the
啊，
severe
这个
cases
从
are
严从实做好
conglomerating
各
in
项
the
的防
bigger
控措
cities and
施，
big
来
hospitals.
避免
That's
大
why
规模
we
的
must
人
always
群感染，
prioritize
从
people
而呢
and their
保
life
障
and
好人
health
民群众的
robustly
健康
and
和生命
earnestly
安全。
implement all the control
那么
measures to
在
ensure
重
their
症
life
病
and
例的
health.
救治上呢，
When it
我
comes
们
to
应该说
treatment
重
of
点
the
啊
severe
做了3个
cases,
方面的
we
工
have
作。
mainly done the
第一
following
呢，
three
就是
things.
要
So
加
firstly,
强定
we
点医
will
院的建
enhance
设，
the
在对
building
病例
preparation
进行
of
分类
the
收治的过
designated
程当中，
hospitals
那么要把
for
这
the
个重症、普
differentiation,
通型的这些
differentiated
患者以及有
treatment
风险因
categories
素的
of
患者，
the
要
patients
收
or
治到
cases
定
for
点医
those who
院，
are prone to
而且定点医
severe
院呢，我
symptoms.
们
They
要
must
选
be
择
hospitalized in
综
those
合能力
key
强、
hospitals,
管
designated
理水平
hospitals.
高、
For those
医务
we're
人
talking
员
about
素质过
those
硬的这
relatively
些医院
more
作为定
advanced
点医院，
with
集中专家、
more
集中
professional
资源，
medical staff,
将重
better
症
equipment and
和有
facilities,
重
so
症
that
高
we
危因素的
will
这些病
mobilize all the
例收治
resources
入
of
院，
those
其中呢
experts
重症
and
要
the key
收入到
resources
ICU
to
进行
provide
治疗。
treatment to those severe
第
cases,
二
especially
呢，
the very
这个
severe
由于我
cases
们
obviously
存
will
在
be
的这个重
treated
症
in
资
ICU.
源的
Or
不
secondly,
平衡啊，这
because
样
we
的一个
have
问
an
题，
imbalance
所以我们也在
of
指导
the
各地
medical
进
resources
一步
for dealing
扩
with
充
such severe
必
cases,
要
so we
的
have provided
医疗
guidance
资源，
to different
要
regions
求
and
各地呢
provinces to
要
expand
加
the
强
necessary
重症医学
medical
专业的建
resources.
设，
They must
要加
build
强重症医
the
护人员
relevant
的培养，
professional development
进一步
for
的
the
提高
healthcare
定点
providers
医
in
院
terms of the
重
capability
症
of
救
dealing
治
with
床
such
位的
severe
比例，
cases.
并
They
配
must
足
build the
配
relevant
齐重症
medical
医疗
beds
力
and
量，
other facilities
确
and
保
equipment
在疫情期
for
间
dealing with
能够保
such
证
severe
每一
COVID
名
cases to
重
make
症
sure
患
that
者
during the
都能
pandemic
够得
each
到有
severe
效的
case
救
patients will
治。
be properly treated.
那么第三个方面的工作呢，
The
就是
third
针
prong of our work is that in response to the population who are prone to the severe cases are typically very senior citizens and suffering from very severe underlying diseases. We have guided all different provinces to make sure that they need to stay ahead of curve. Basically, they monitor the indicators of those severe cases whenever there's a kind of early warning and must step in, provide intervention as soon as possible to make sure that to avoid the aggravation of their symptoms. Even such from severe cases from people already are infected, also we need to mobilize multiple disciplines to provide the treatment. So I must emphasize that the treatment of the severe cases is only one link of the overall process of COVID pandemic prevention control. If our prevention control measures are not properly implemented or in a very accelerated and faster way, a large number of population will be infected, and there will be a surge of the severe cases in the space of a short period of time. Therefore, all we need to do, and all we can do, is to implement all steps of our dynamic COVID-0 policy and measures so as to prevent the infection. We must make sure those vulnerable population will not be infected, so that the health and the life of the people will be properly safeguarded. Well, thanks so much. In terms of time, we only have time for 2 more questions. On the third row, the right, the second journalist who is in black. I'm from Caijing Weekly. Compared with other population, why are the elderly population more prone to severe symptoms and even deaths after they are infected? Mr. Wang Huaqing, please address this question. Thank you for the question. Well, after a senior citizen is infected, the percentage of those people who suffer severe symptoms and even end up being killed by the virus is very high. There are many physiological and pathological reasons. Well, firstly, we know that when an elder is getting old, their immune system is being weakened. Well, secondly, when a senior citizen is infected by either virus or bacteria, their own immune system will be damaged, so there will be more complications or inflammation. Well, thirdly, most senior citizens tend to have some kind of underlying disease, and this infection, COVID infection, will worsen their underlying disease, and more complications may happen. This is not unique to COVID virus. We know even for the seasonal flu, there's still a relatively higher fatality rate for the senior population, and the reasons are the same. Also, people typically, anyone can carry some kind of pneumococcus bacteria, as well as other viruses, very typical viruses. Also, like herpes viruses, the reason why senior people are more prone to herpes disease, also for the same reason. So research indicates that COVID virus may find its way into a lot of organs and tissues of a human being. And if the elder people who have not been vaccinated are invaded by the virus, and if he or she has any disease of diabetes, high blood pressure, or chronic pneumonia, or other lung disease, cardiovascular disease, or chronic kidney disease, or other blood clot diseases, it's very easy for such people to be further weakened by virus and have very severe complications. That's why they must be properly protected. Last question. Again, the third row, the lady in white. Well, thank you, Mr. Moderator. I'm from Red Star News. We have received some feedback from the public that for certain communities, they have adopted some so-called hard quarantine measures, such as the locking of the door by barbwire, also has the clogged passage, which has caused some safety risks. Do you find those measures reasonable? And how can community adopt these so-called precise and scientific quarantine measures? Mr. Wu, please address the question. Well, thank you for the question. I personally have been implementing a lot of pandemic prevention control tasks. And to control the risk, I myself have been quarantined, or home-based quarantined, or collective quarantined. I have the same experience, just like everyone else. Considering the different situation of different parts of the country, for certain communities where we already have a community spread for some period of time, when we cannot conduct the very accurate, precise epidemiological research and contact tracing, we might put in place lockdown of certain regions or adopt a complete dynamic static control measures for the whole society. For relatively residential compound with large resident population, we might adopt the so-called grid-based administration in that community, so that way people's responsibility and the tasks will be more clearly identified so as to avoid the cross-infection among different grade cells. So if we divide a resident compound into different cells, and we can put in place a physical quarantine so that for those cells within that grade can be released from the lockdown when the conditions are met. That way, that particular cell will not have to wait for the overall release of the lockdown for the whole community. That way, we can achieve this precise control and pandemic prevention. But that way, the staff member working within that particular cell or grade will not suffer from the risk of cross-infection. During the pandemic prevention control, by putting in place some particular checkpoints so that there's no risk of the overflow of the virus. That's quite necessary. Nevertheless, when we are putting in place the physical quarantine measures, we must be careful in terms of the geographical situations. We must make allowance for the safe passway and must make sure that people on duty, on guard, we shouldn't simply lock everything up. And must make sure when the emergency happens, all the pathways can be used. So this is kind of relatively softer physical quarantine. All these measures are the purpose of make sure that for those perpetrators who break the rules of the quarantine will be stopped so as to reduce the spread of the virus. So also the community management committee must understand the population number as well as the distribution of the population and adopt the emergency plans.
There should be the emergency response plan to ensure that if the residents are encountered with any emergency, they know who to contact and can evacuate quickly. Such safeguards should also have a humanistic care, and such work should win the support and understanding of the general citizen before they can be really implemented. Winning the battle against the pandemic is the common aspiration of all citizens. I call on everyone to abide by the rules of quarantine. The quarantine is to quarantine the transmission of the virus. It is not to isolate anyone behind the fences. It does not separate our affection. Your support is the biggest encouragement to all the control and the pandemic response staff. I'd like to salute all the citizens for your efforts and understanding. Thank you. On today's press conference, guest speakers have shared with us pandemic control efforts, the hospital treatment.
好，请问，拿麦克说一下。
谢谢。Sorry, you didn't answer my second question, which I asked: is regular testing going to become mandatory for everyone in China? And also, if I have this opportunity, can you tell us the data on vaccination rates for the elderly? You told us the numbers for people over 60. Can you tell us the numbers for people over 70 and people over 80? Thank you very much.
好，请翻译一下问题。
刚才第二个问题我还想再问一下，就是关于现在在居民点附近已经开始了常规的大规模的人群核酸检测，这是否是强制性的？是否会在全国推广？我另外还有一个问题，想问一下，是关于老年人的疫苗接种率。我刚才清楚地听到了60岁以上的老人的疫苗接种率，想问一下，是否有70岁以上、80岁以上等其他年龄段老年人接种率的数据？谢谢。
好，关于核酸检测的相关的问题呢，我们请
For the NAT testing policy, I'd like to invite Madam Guo Yanhong to take that question. Thank you for your interest and attention given to NAT testing. NAT testing helps us to detect the infected. And NAT testing can also help those infected to be treated and diagnosed early. So it is crucial. NAT testing is adopted when we doubt or suspect community transmission. That's why, and that's when we carry out the mass testing that can help us to lock and target the infected group of people and can help us to precisely identify the infection. That is the role played by the mass testing. Once we identify the susceptible places or communities, we want to have a precise identification of the infected. So we have regional mass testing, and that is combined with the mass testing targeted at key communities, key places, or key people. This can help us to fight the pandemic and can help to detect the early cases. Thank you. And for the vaccination rate among the elderly above 70 years old and 80 years old in previous press conferences, the Health Commission's officials have provided data. In the future, we will continue to hold conferences to release latest data, and please stay tuned. Thank you. That's the end of today's press conference. I thank you.